Well, welcome back to the podcast, Robert. It was awesome to have you last season, and I'm excited to have you on for this season and this episode. Um, I've been meaning to dive into addiction and how we can see addiction as we can take a more holistic approach and how we are viewing addiction through a lens of maybe like social isolation or loneliness for people that wrestle with substance use disorder. But yeah, it's just one of the many things that I want to get into as a therapist. And I'm going to be asking, what's your experience been with treating people with substance use disorder, and what have you kind of, what's just your overall experience?
Excuse me. Thanks for having me back. A lot of stuff going on around addictions that goes on around addictions that contribute to it. You're spot on about the isolation factor, certainly is one of those. Another is sort of coming out of family with addictions is also a variable that we need to consider, that if you have kind of history in the family system of people that were or are addicted to alcohol, drugs, you're likely to be more vulnerable. And some of that may be genetic vulnerability. Some of it is just social learned vulnerability. But I really appreciate you naming loneliness. And part of it is that people, and I want to focus on men, if that's okay.
Yeah,
Answering
yeah. I was
I've
gonna
been there
actually,
with like, okay, how does this affect men?
I was gonna ask about that,
Yeah.
but you've already kind of started, so.
Well, there's some overlap. I mean, it's not like men are, unique in terms of addictions, because women certainly experience it to a high degree in some similar ways. And I feel like in terms of what you were raising, Micah, around the notion of loneliness or isolation, the other is real in terms of its lubricating feelings of loss, depression, anxiety, and it's inevitable that guys that have seen over the years will talk about addictive behaviors, and it's alcohol, drugs certainly is influenced by who we hang out with, obviously, and what the culture expects of us. So college age drinking, for instance, or high school drinking can become really, really easily addictive over a period of time if we consistently get peer pressured into drinking.
Yeah,
But also the idea of using it as a supplement to feeling isolated or to feeling like an outsider or just being without sort of other interests. We are more vulnerable to using. And I think it's easy to become an addict, just not intentionally. No one intends to become an addict
hmm,
or get addicted to any substance. But I think the repetitive use of it, the dependency on it, it's the dependency, I've got to have it. And the continued use of it, the repetitive use of it really becomes this vulnerability. And then the body just develops, like with tobacco, it develops
yeah,
a biological sort of systemic dependency on that. There's a really important to consider that it's not just any one thing, but it's a combination of the repetitive use, the developing of dependency, and not dealing with issues of depression, anxiety, or loneliness in
hmm,
another way. So if it becomes our major kind of go-to mechanism for calming down, for relaxing, for breaking out of isolation, and just sort of this is our go-to source for feeling better, then it becomes really vulnerable. Then the individual becomes really vulnerable. And as we
that
talked
makes
about,
a
I
lot of
think the
sense.
last session we were in together, the last time you talked with me, men do experience more social isolation than females do. We tend to have less close friendships, less intimate friendships. We tend to hold things in a lot more in terms of what's going on with us. We seek counseling, therapy, less, we're less likely to.
Hmm.
And so stuff builds up inside of us and we medicate it.
Okay, I had like a thought. Oh yeah, it was about like I don't know like what your age range of clients are, but my generation with Gen Z, the one of the biggest things that I see as far as addiction is weed and vaping. So I don't necessarily see alcohol too much, maybe like in pockets, because there is like I read like an article that said like drinking is going down, but I think it's because of the vaping and the weed.
Yeah. And they're going out. Yeah.
Yeah.
And you're absolutely right. I do see my population of people I see actually range in age from 20, usually about 20, 21, a few high school students periodically to 80. So it's just,
Oh, okay, so, like, a
yeah,
huge
yeah.
range, yeah.
And I live at a college town. So
Oh,
I
yeah.
live in Swarthmore, where Swarthmore College is located, and University of Pennsylvania is on the train to Swarthmore. So I see college students as well as some high school, and then younger adults in their 20s. And you're right, particularly among your population in terms of age group, the vaping and the weed are the two sort of prominent mechanisms that people use. And oftentimes, sort of like in my earlier life, smoking cigarettes was clearly the way to calm down and to relax and to
Yeah.
be part of a group. Vaping and weed are both have social lubricants as well in terms of feeling I'm one of the group, everyone else is using, I'm going to use. And then it leads to an individual, even not with the group pressure, individuals start using it because your body becomes vulnerable and addicted to the substance.
So, is a social lubricant, is it, like, a way for people to kind of deal with maybe, like, social anxiety in certain settings
Yeah.
and trying to ease into, socializing, trying to maybe, like, mask those symptoms?
Yes, very much so. And I don't know if any of us would be around people that are vaping a lot and or doing a lot of weed, and you say, "Why are you doing that?" Um,
Mhm.
I mean, I really relax. I feel better about it. There's always a positive reason, right?
Yeah.
For nobody says, "I'm gonna smoke some weed or I'm going to, know, do anything that's addictive because because I feel miserable and I wanna hurt my body." People are saying,
Yeah.
"Okay."
Yeah.
And the addictions also lead, there's a way in which patterns have become addictive. There's nothing inherently absolutely devastating or terribly wrong about smoking weed or about any of the, drinking or vaping. What's the problem is when it becomes habitual and I
Mhm.
cannot not do it. And
Okay.
what happens to the individual is that we tend to minimize. I don't do it that often, even though I do. We minimize, justify it, and rationalize it. I'm doing it because I'm really anxious or I'm really worried. And then we justify it by saying, yeah, it's a good thing for me to do because of the situation I'm in. And we don't think of alternatives, going for a run, working out, connecting with friends over coffee, some other things that we could be doing. So we
Yeah.
minimize, justify, and rationalize it.
Yeah. Yeah, I've seen people kind of, in my experience, when they start, like, using it and they start on that path, their personality changes in a way, not like it's hard to explain. They just kind of like their I guess, their posture toward life is, a little bit more detached, and that's kind of when I say, like, their personality changes in a way that's not really like them when it's, like, a constant use. So, that's kind of coming from my perspective, I've never, like, used any of the substances we're talking about today. I've had friends and people that are close to me use them, and I kind of felt like they've kind of sort of changed in a way that kind of it's kind of hard to continue and develop a relationship with them, if that makes sense.
In terms of what I'm sensing you're talking about, is harder to have a conversation or be feeling like they're totally present, totally interactive
Yeah.
in a mutually kind of like interesting way that they go into
Yeah.
themselves. They kind of buzz out in some ways.
Like, kind of like they're checked out,
Yeah.
and I just like yeah.
Yeah. And it's hard to have a conversation with somebody who's checked out.
Yeah.
And that's also a way that people will feel like I don't have to work hard at being social. I'll just check out. I'll feel like doesn't matter what's going on in the environment. I'm kind of and so it's sort of interesting, isn't it? Because it can be the vulnerability can be using either of those or any of the substances as a way to separate. Because I'm lonely, because I'm isolated, it'll help me chill and feel like it doesn't matter that nobody's around or that I'm not engaged very much. Or if I'm with other people using weed or any of the substances, you can end up feeling like, oh, I don't have to work so hard being social. I can withdraw and
Okay.
people are around me.
Yeah. So So what I'm kind of like getting is that, because like the feeling of socializing or the feeling of, being isolated or the feeling of feeling alone is too like overwhelming. So it's because it's hard to deal with that and like sit in the feelings aspect of it, it can be sometimes easier to lean on the substance so that kind of you don't have to go through and process those feelings, if I'm correct.
Yeah, relationships take effort.
Yeah.
And what's been your experience for yourself in terms of do you feel when you have friends that are using, I don't know, vaping so much as weed, but do you feel like you experience them differently? Do they
Yeah. So okay, it's been a minute. Last time I can think of when I had some friends like start to go back to using it and kind of like go through like a cycle. They
the
would kind
weed or
of
the vaping or which?
well both.
Okay.
Both. They would kind of like withdraw and kind of go silent for a while, and I would wonder, okay, is everything okay? And they wouldn't like respond. They'd be less responsive to like messages or reach outs. So you kind of have to guess like is this person back on their substance again? And so it was kind of like through that's more of a I would say like you feel the push pull cycle
Mm,
where sometimes like when they're off the substance they're kind of like more present and when they're on the substance they're more like distant or
right.
they with
Mhm. And that's, yeah, and that's a pretty typical experience. And it
Mhm.
also leads to people that are using, particularly in a repetitive, almost addictive pattern, tend to hang out with people that are also using.
Mhm.
Because people that aren't, it's hard to be, when to look forward to hanging out with a friend who's withdrawn, right? And so I'm
Yeah.
sure you kinda like say, "Oh, yeah, I'm gonna, spend some time with this guy, and he's not gonna be there for me in terms of he's gonna be stoned or wasted somehow." And it's like, "Why am I
Yeah.
doing this?" And
I
so it's
guess
easier actually if you
yeah.
if you join them in it, then it doesn't matter. But if you're not
Yeah.
joining them, then it has an effect.
Yeah, and I guess looking back, like, at the time I took it personally, like I thought I was doing something wrong or,
Mm,
I kind of thought that. But, when I started doing research on addiction and doing research on that, I sort of realized that, it's just the person kind of might feel maybe I don't know how to word this. Like you said, they're less likely to hang out with people that, that are sober because that kind of reminds them of their own sober self. So it's kind of easier to socialize or be around people that are not.
exactly. And then it's also really hard if a person continues to use and then develops it as a primary kind of source of relaxing or source of dealing with issues in their lives. And the repetitive use of it tends to be this develops the dependency that you really have a hard time kind of connecting because you never know whether they're going to be wasted or not, whether they're going to be
Yeah.
stoned, whether or not they're going to be totally present.
Yeah.
So it's a landmine kind of, are they gonna be there or are they gonna use or aren't they gonna use? So for somebody like you who's not using anything, you have to figure out what's gonna happen tonight. Are they gonna be with me or not?
Yeah, and it's kind of like it kind of takes you through and we can go there's a whole I can write a whole book on this about like, being in a relationship or being friends or being the family member of someone wrestling with addiction. It kind of takes you through like your own sort of cycle of, you're not, it's like kind of like an emotional roller coaster of trying to um, figure out which like, when they're sober, this is like their normal self, but when they're
Mhm.
like on the substance, they're kind of acting in a way that's like not really in alignment with their values. So you're kind of like confused of which person is which. But like the
Mhm.
missing piece is the substance. And you think that they're changing, but it's part of it is the substance.
Yeah, and, the very sort of definition of assessment of addiction has a lot of questions asked of the person, how much to use, etcetera. But really what it boils down to is that, particularly with addiction, it's and I wanna separate the difference between using and addictive using.
Hmm.
Using a substance socially, casually, periodically is very different from moving into being an addict or being addicted to it. And And the point of addiction is that the primary relationship that the individual has is with the drug that they're using.
Yeah.
All other relationships, girlfriends, boyfriends, friendships down the hall, any of that other stuff only are fillers. But the primary relationship is a have to have, I have to have. And we see that with certainly the loss of grades, the loss of friendships, the loss of
Mhm.
people then cluster around other people that are using as well. So it's hard to be wasted when you're around sober people.
Yeah, that makes sense.
Yeah, and it's hard to be sober around people that are wasted. And
Yeah,
so we cluster
yeah.
around those differences oftentimes, and that doesn't build new relationships other than with people that are in the same category.
Yeah, it's sort of like a self-fulfilling prophecy, whereas you
Mm,
feel alone, you feel like, a little or like depressed because of you're not having like the social relationships that you want. So then you use as like kind of a form of social acceptance, but then that kind of creates like that makes you kind of feel worse in a way where you're not really being engaging your authentic self.
mhm.
So that kind of makes you feel more alone, even though temporarily you feel a part of a social group or what have you, because everyone else is using.
Yeah, and so it breaks down the loneliness because you're using it together, and actually, in some ways, I don't know if this is your experience, it's almost particularly with college-age students, I think, in some settings, and more adult people who are addicts, it's like if you're in a group that's smoking or weed or using any of the substances, and everyone else is using it, you're not, you have to explain yourself.
Yeah,
And you have to defend it, and it's
yeah,
almost like being a vegetarian. If you eat meat, you never have to explain why you eat meat, but if you're a vegetarian, people say, "Why are you vegetarian?" Then you have to defend it, you have to explain it, like,
yeah,
you're the problem, you're the outlier, and so if you're with a lot of people that are using and you're not, then you're the odd one out, and you're the one that's people feel uncomfortable with, etcetera, because you're an
yeah.
outsider.
Yeah, and we all have a need for I don't know if it's biological. I think it is biological. We all have a biological need for, being a part of a group. And so there's like a risk factor when everyone else is using and you're not using. So it it makes you feel more inclined to use because you don't want to, like, be left out because, that goes against your biological need to be apart. And also, if you don't really have, like if that's kind of like if that environment is all you have or all you're used to, then you're not going to know that there's a different way to develop, social relationships.
Yeah, yeah, and, there's a kind of a theory that people who particularly that start using in their teens and their early 20s, who really do be getting into addiction, fail to grow into adulthood. They tend to get frozen in the age of 19, 20, 21, or 16, whatever that is.
Mhm,
That it really stunts our social growth, and part of what you're doing as a college student right now is that you're forming all kinds of relationships. You're dealing with, falling in love, falling into, groups, falling out of groups, trying things out. But if you're sober, you have real experiences and you have growth experience. If
mhm.
you're not sober, if you're addicted, you're kind of not trying a whole lot of new stuff out. You're locked into a dependency pattern that limits that growth period, that you have. And then later on, the implication is that you end up continue to use in your 20s and 30s, and then end up in rehab because you really screwed up and really
So what do you
have a
mean
hard
by,
time
like
developing relationships. Go ahead.
what do you mean by, like, the implications, like, with being limited? Do you mean, like, socially or, like, maybe, like, in terms of emotional maturity?
Yeah, yeah.
Okay.
Very much so, emotional maturity. We get to be mature through a series of hoops that we jump through and jump over, and we navigate all kinds of things consciously and unconsciously through our lives. And so, but if I'm using to escape those hoops, to not have to deal with the real world, to not have to navigate or negotiate relationships, then I'm not really giving myself experiences that are going to move me into a level of confidence, a level of engagement, a range of ways of experiencing the world. I'm locked into experiencing it only through the process of
Like,
somehow a state of mind
detachment.
that's not sober. Yeah. Yeah.
Yeah, and so I guess when you're detached, you don't give yourself the opportunity to develop those skills
Mhm.
for being, mature or being able to handle different things like in your life. So I guess it does make sense, like the way that you're putting it, like with individuals that do struggle with substance use is that sometimes they could be in a place where they're not like open to a level of maturity that everyone else is kind of going forward developmentally.
Yeah.
And that kind of like leaves them, I guess, even more alone because they're not like growing it in that sense.
They're not. And, the other piece that I'm thinking about as we're talking is the piece of where masculinity fits into this picture as
Yeah.
well. And I think that there is sort of one of the ways we can experience sort of being seen as, truly male and masculine is to prove how much we can drink, how much we can drug,
Yeah.
and how much we can kind of be deviant. Actually, that's that's sort of one of the criteria for an old masculinity test that was used in a long time ago in the 50s or something, was asking people how much they could drink and how much if they drank to the point of getting drunk, then they were more masculine than if they if they just had a glass of
Was
wine.
this like a questionnaire or something?
Yeah,
Oh, that's really funny. I would like to actually look
yeah,
that up.
and it's like, oh, if you haven't been deviant, you can't be male, or you can't be masculine at least, and so the less deviant you are, the more feminine you are, and the more deviant you are, the more masculine you are, and so how much can you take in? And so, and so a lot of stuff, even around the drinking is how much can you take? How much can you drink? How stoned can you get? How wasted can
Yeah.
you be? And then you talk about it as bravado the next day. Man, I was so wasted. It's like, yeah, that's a great story. Like, you're talking about this.
I mean, I guess like I could see it being for men and even like in my generation to a degree, not as much as I've researched with like generations past,
Mhm,
is that it could be a sort of, social achievement or achievement of proving that you are man enough
mhm,
if, you're having all these substances and you see other young men do it and you feel that kind of validates your sense of manhood, like, oh,
mhm.
this is the thing that actually validates my manhood, not like who I am, like, authentically, but kind of just this external source of using substances being validated in that.
Yeah, it's a gateway to manhood in that sort of if you tried this, try that, then you really are kinda like up with the other guys, and it's yeah, it becomes a self-fulfilling prophecy. It's also, again, it's one of those things where trying drugs out, whether it's weed or whether it's even, any of the other psychedelic drugs, in and of itself is not a big problem.
Mhm.
The problem is it's not what we do, it's why we're doing it.
Yeah.
And it's how
Yeah.
much we're doing. And so a one-time thing or periodic recreational use of a substance is, just recreational use. And if you have the right space to, do some acid, or if you have right space to do mushrooms or weed, I'm not saying go for it, but if it's not a big thing, it's not necessarily going to lead you to be an addict,
If it's, like,
but it's
appropriate for you, I would
yeah,
say.
if it's appropriate for you. And so it's not what you do, it's why you're doing it and how much you're doing it
Yeah.
becomes the core variables, I think, that we want to look at.
Yeah, and I guess, like, there's, like, a problem when men are, like, seeking to numb themselves from what
Mhm,
they are feeling. Then that's, like, that could be, like, a reason to not do that because, like, are you really confronting things or are you trying to go around it? And I guess, like, when we kind of try to detach or try to not feel things and that kind of, like, that kinda it doesn't help. And I'm learning even, like, in my own therapy, I just started therapy again, I think, like, last month, that, like, I have a huge as much as I have this podcast and as much as I, want to be a therapist, like I can struggle with confronting my own feelings and
mhm, mhm.
processing them because, being conditioned to not do that, or even just the fact of like, okay, it's uncomfortable, it's scary, then it's
Yeah,
going to be like substances will look more attractive.
mhm. Particularly, yeah, and it's an interesting point you're making around I feel like the therapy office becomes, in the best of all worlds, becomes a safe place to totally open up about what's going on. And if you don't have a therapist that you trust, and if you don't have a therapy environment that you can just really feel pain, feel tears, tell your story, however raw it is. If you don't have that in therapy, then you're really missing the value of therapy.
Yeah.
But it's for many people who don't ever go to therapy, and men are less likely to go to therapy than women. The tendency is to withhold any of those issues in our lives. We live with a lot of shame, the shame and guilt that guys walk around with. And I remember some studies, some psychology studies from a few years back that said what are the themes that men bring into therapy? And the two major ones are shame. I'm
Mhm.
inadequate. I'm a failure. Whatever level they identifying with my body isn't as big as other people's bodies. My penis isn't as large as other people. Whatever it is, we can do whatever we want. Or so I feel shame or I feel guilt because I screwed up. I don't perform well. I feel like I'm a jerk or I don't trust myself. I hurt other people.
Yeah.
And those are things that we need to be talking with each other about when they happen. If I feel inadequate, the best thing I can do is talk to another guy about what I'm feeling like. Man, I'm feeling like really like a bumbling idiot at times, and I don't know if that's true because other people can give us feedback, but
Yeah.
we don't show it to other people. And if we do, it's more likely we're going to tell a female than we are going to tell other
Yeah,
guys.
that's something that I've, kind of, like, thought of recently is it that men are more comfortable being vulnerable in talking about, like, you know, wrestling with their identity and shame? Are they more comfortable talking through through that with a female as opposed to a male? Because when I just started therapy again, like, I do therapy with a guy, like, guy therapist. Before I had a female therapist, and that was, like, a huge adjustment with, like, wait a second.
Can you trust it? What was the adjustment like? What was the adjustment?
So I've had my female therapist for, like, what, like, 5 years or so, and the adjustment was, like, I have to get used to another guy being present while I'm telling, like, the most craziest story ever that I think is so crazy, but it's actually not,
Yeah.
and just him, like, listening and being present, but also, like, affirming and challenging me. I think people think therapy is just talking about, like, feelings, but in my experience, it hasn't really been that. It's been mostly challenging me to confront things
Mhm,
about, myself that I would rather not.
mhm.
If I
Right.
didn't have the therapist, I would rather not, but it's
You avoid
actually
it.
like yeah, it's actually like for men that are, from w what I, what I tell guys is like, it's more about you confronting things because you say you wanna work on things, like, I think a lot of men, they do want to work on things or overcome anxiety or even substance use, but it's the aspect of actually, like, doing it or confronting it, like, by themselves.
And figuring out, and sort of parts of our lives that keep us from being who we want to be.
Yeah.
And I remember my own therapy, certainly a long time ago. But I grew up with a dad who had a very intense temper, and it was scary as a kid, but it was also something I adopted when I was first in when I got married. And I didn't have a temper until I got married, and I did. And all of a sudden, I become my dad, and I would justify it saying, and this was like 40 years ago or so, but I would justify it saying, "Well, I just have a temper." And other people
That's
should,
just who I
my
am.
wife should notice that I have a temper. Therefore, she should not create a situation in which I'm going to have a temper, as if the temper was her fault. But it kept me from having the kind of relationship that I wanted to have and not be married with somebody who was afraid of my temper. That was not useful.
Yeah.
And so going to therapy was, where did that temper come from? Where did you not learn? How did you not learn to deal with emotions in a different way?
Mhm.
I can be angry at something, but most of anger is about being hurt, scared, worried, anxious. And then we express it as anger. And
Yeah.
so once we are in therapy and our therapist says, so what's the alternative to yelling? The alternative is to say, wow, I'm really hurting. I really, or I'm angry. I don't have to yell
Yeah.
to say I'm angry. I can just say I'm angry or I'm hurting. So
But
it's that
that's
pushback
yeah.
that you're describing that's so important that can take place in therapy.
Yeah, but that's like I think with a lot of guys, it's easier to say I'm angry than to say I'm hurt because I'm
Yeah.
hurt is a lot more vulnerable and like saying I'm angry, it's like, oh, I'm getting defensive. I'm gonna puff up. Like kind of like what we talked about before. It's like
Yeah, right.
trying to show your manhood
Yeah.
with like through aggression. And I think that's one of the reasons why we might like go to substances is because it's easier to numb the hurt
Yes.
out with substances and numb the anger out versus trying to confront it.
Yeah, that's a very important point you just made, Micah, in terms of it is the substance has become a substitute for dealing with feelings and for really processing what's going on. And and again, it's the why I'm using it. If I'm using it to escape, then I'm using it for the wrong reason. What are you escaping from?
Yeah,
Which means you're avoiding something that's going on in your life. If you're using it for just situational pleasure or, periodic pleasure, because it's kinda nice to get high sometimes, or it's nice to, you know, to use a particular substance. But if it's an ongoing escape hatch, then it's avoidance, and
yeah.
then it hurts having real relationships in real time with real people.
Yeah, I guess you don't like you kinda aren't really able to because, like, if you're detached and the people around you, like, they need you to be present, then you're not really able if you're not able to do that, that's gonna kind of make you more isolated in a sense.
Yeah, and then you're less Yeah, you're less likely to deal with the issues and carry it on. And it's kind of and then they get in the way of having real relationships with, sincere relationships with other people. So it's kind of like a catch-22. I'm hurting, so I'm going to deal with the way I'm going to deal with hurting or anxious or angry. The way I'm going to deal with it is to smoke weed or use weed or some other substance, and that's never gonna get to the point of what's contributing to the anger, what's
Yeah,
hurting you, why what support do you need? If you're struggling with self-esteem, seeing somebody to talk about what contributes to the self-esteem is much better than
yeah.
getting stoned or
I
getting
think
wasted.
I think men see, like, talking to someone as, like, a feminine
Mhm.
thing, and I
Yeah.
don't know if, like, if you've experienced that with your clients.
Yeah, I have a pretty long list of clients in terms of my work, and probably 50% of my clients. I see a bunch of couples who are going through issues around having kids or dealing with divorce or affairs, etc., or sexuality issues. But 50% of the people I see, maybe 60% are individual males. And oftentimes it's really old material that just has never been resolved. And you're right though. Men tend to not go to therapy as much as women do. I always when I used to, I was a professor in this field for a long time and in my lectures I'd always say, men go to jail, women go to therapy. And so there's something wrong with that picture. We
Yeah,
either screw up by racing our cars while we're drunk or, doing something really stupid to hurt people. And we don't always go to jail, but we end up having more damage done by us overall, throwing things,
yeah,
breaking things, etc. And it's if we went and got some support, or even, it's not just about going to therapy. It's just having really close I think male relationships where we can not feel so isolated from each other and we're together if we're playing a game, if we're watching porn, or if we're playing, soccer. Men are together, but we're not together in terms of really communicating what's going on with our lives and the
yeah.
intimate conversations that need to go on.
Yeah, I think this is kind of where because I talk a lot about friendship, so I think that's another piece of it is, not only is that do we need, like, a sense of professional help or professional intervention, but also we need, like, strong community of men to just talk to. I think men don't see it as a need. They don't see it as like, I need other men to kind of lift me up and build me up. Uh, so it's just kind of, it's it's kind of, sometimes an afterthought, to a degree with some people, but I think if we see it as a need, if we kind of are convicted in that sense, then we won't, like, feel so alone, and we won't once we prioritize the people around us, we won't feel like so
I
isolated.
say,
'Cause I feel like the isolation we can talk about, like, isolation, like, post-COVID and stuff, but I feel like that like, a sense of that kind of existed on some level. Like, just COVID kind of
yeah.
brought that to the surface of what's really going on, and I think, really it's just being humble to admit your need for other
Yeah. You have to be vulnerable, right, in
Yes.
order to show up. And, I was thinking about as you were we were talking about addictions and, not just the substance stuff, but, certainly porn addiction has been something I see younger men around
Is it my
particularly.
generation, Gen Z? Is
What's
it
that?
Gen Z?
What's that? I'm
Like,
sorry.
my is it my generation?
Your generation,
Okay.
and, your generation into mid-20s, early 30s, kids that grew up, particularly, in the last 10, 15 years, with porn so accessible, like from 12 years old on or younger, that guys started seeing porn as their first sexual relationship
Yeah.
and really struggle with separating themselves from it, and then it can become an addictive source. But so can computer games and anything that helps us that leads us to intimate relationships. Again, using porn it's just using porn. To use porn addictively is to use porn as a substitute for real relationships. To use
Yeah.
computer games and having to be on the computer to play games over having real life relationships. Anything that leads us away from intimate interactions with other people. And I use the word intimate intentionally because oftentimes people say, "Oh, intimate means sex." It doesn't. It means vulnerability. It means deeper
Yeah.
connections, that that soul connection that we benefit from. And if we're escaping away from that, then we're really not engaged in the world the way we could be. And we're also not
Yeah.
going to be very good partners if we partner up with a spouse at some point or parents, because I have worked with, actually right now, I'm working with a couple of guys who are like in their late 20s, early 30s, and they have a child and they're so locked into, 2 of the guys I see are so locked into computer games. That's what they grew up, that's what they go to.
Okay.
And you
Yeah.
have a crying baby and or a baby that just wants to play or a little toddler. And it's like, "Man, I just want to get back to my game." It's like, "God, you're a
And it's
dad."
like, well, how do you well, the most important thing is being emotionally present.
Yeah, yeah, yeah. Good, well said, yes. Being
Yeah.
emotionally present, meaning
I
I
think
can
it's
bring my emotions and I can witness your emotions, and that makes
yeah.
us have a connected relationship.
I think it might be like priorities are a little bit imbalanced. But like there's nothing wrong with like video games, but it's like
Mhm,
it's more of like what is like the priority? Is it being present or is it like the games? I think to a degree like men could prioritize certain things in the way that we were like socialized to.
mhm,
And it's not until we, have intimate relationships or have a spouse, have kids, or it's not until we have a friend that will say, "Get your get your life together." It's not until like those seasons of life where we have
mhm.
to really confront, you're kind of forced to confront what you've been prioritizing, what you haven't been prioritizing.
Yeah, yeah, yeah. And it's a blessing to have somebody who cares about us enough, as a partner, as a friend, to call us on our stuff.
Yeah,
Man, you're locked into this one modality. You're locked into your drug use, or you're locked into pornography, or you're locked into games. It's like, come back, engage.
yeah. Yeah, and it's difficult to like it can be difficult to have those conversations with people that you see are using or people might initiate conversations with you when they see you're going down a path.
Mm,
So, but it's really those are like the relationships to keep. If people are like gonna hold you accountable and not gonna allow you to kind of like just fall by the wayside, those are relationships to keep. And I think like for men, it's difficult to be called out on something because we have so much like,
yeah,
defensiveness. So I think just even that can be difficult. But I think it's when like you start to see like, okay, something needs
I was thinking, as you were talking, Micah, one of the things that if you are have an addiction and it's severe enough that you go to a addiction treatment program for there's sex addiction programs, there's alcohol addiction, drug addiction programs. I don't know if there's computer game addiction programs, but there should be. Uh,
Yeah.
but if you're on an addiction program like AA, NA, any of those, one of the things that happens in those programs is that they take place in groups in sort of very confidential places so that the rules are really clear. Whatever anybody says never leaves the room. People are able to be really honest. They're able to express feelings, talk about how much they use whatever the substance is, or how much of whatever they're doing with porn or whatever they're doing with their addiction. But it's the first time for many men, particularly, to be in a room with a number of other people, both males and females, where they can really openly honest talk about their feelings
Yeah.
and their experiences. And I've always thought it's really unfortunate that for many men, particularly, they have to go to a place of really hitting rock bottom before they can ever find a place that they can trust other people to listen to them
Yeah.
and learn
Yeah.
other people's struggles and learn other people's stories.
Yeah. Because it's like they don't have that like, it which should be, like, a normal thing, which should be just, like, an everyday normal thing. It's like you have to experience, like, a crisis to even get there.
Yeah, yeah,
Yeah.
and it takes the crises to motivate. It would be nice to build that into the system that in our everyday lives. Do you have a men's group that you belong to, or are you
I have I kinda have a few. I have one that is facilitated on campus, and I have one, like, through Men's Couch. Like, we kinda like, a group of guys, we just come together. And then just, like, I just have, like is I'm a person that, like, my some people have pointed this out, like, within me that I'm, like, a person that really like, I'm very intentional about my, like, connections around me. I'm very like, it's something that I prioritize, and people see I have, like, very close male friends, and it's almost as if it's, like, not the norm in a way. And I'm trying to like for me, I'm trying to push that a little bit. I'm trying to like, kinda set the example and push that, also pushing other men to do that. And it's a challenge. It's rewarding, but it's also challenging because you're still fighting against certain cultural like inclinations and fighting against those. But I would say like I have a pretty good network of guys that's kind of is still building. But yeah.
I think part of what happens, and it's wonderful that you're doing that and that you are that person who I suspect initiates those kinds of relationships from the
Yeah.
beginning. And, one of the things that's true, I think for most of us is that somebody has to start it. You know,
Yeah.
two guys can if one of the two guys can say, "Hey, man, I want to just really sit and talk. Can we go for a walk and just sit and talk with each other? Because I've got some stuff coming up." Generally, guys will listen to each other. But
Yeah.
if nobody starts the conversation's never going to happen.
Yeah, you're just kinda waiting for something to happen. I think, like, there's like, we might wait because we don't wanna again, it's a vulnerability aspect. We don't wanna, like, try
Right.
first. We don't wanna do that first, but I don't know, I guess, like, I guess I started with, like, Men's Couch, and it kind of, like I kind of expanded a little bit with how can I, reach other guys outside of Men's Couch? How can I develop those relationships? And it really is just really people really want to, it's just they don't really feel permission to do that. Like, even in, like, today's society, and it had to be pointed out to me, like, by my therapist, like, "Listen, this is all good, but this is still where society is. You're right here. Society is, like, right here,
Yeah.
and
Right.
you kinda have to, like, navigate that."
Yeah. Yeah.
And it can be a challenge sometimes, but, I'm all for the challenge. I'm all for pushing this because it's pushing this because I think it's the only way that we're going to change the future.
Yeah. And the way you're talking about it, it's becomes even more important that there's gotta be some models of people doing it. Somebody has to
Yeah.
initiate, but there's also gonna have to be a vision that's even possible for 2 guys or even a group of guys to really talk through what they're experiencing, romantically, how they feel about their bodies, how they feel about their self-esteem, any of those things. I think that there's a lot of hidden lives that go on inside each life, and
Yeah.
and there's not a great range of models for how for guys doing that. So where do we see other guys doing it
Yeah.
becomes becomes
I think the biggest thing with my generation is, like, joking things away. We tend to joke a lot of things away
yeah.
instead of, like, we might joke, like, I don't know, like, I we might joke about, like, loneliness or whatever, or just anything that's, like, serious,
Mhm,
but really, like, the joke is really, like, this is, like, an actual thing. Joking is another thing, another way to avoid vulnerability in a sense, or really, like, we just need to, like, sit down and really have those conversations and really like it's all like for me like the people around me we're all like learning because I can just tell within myself and with the people around me that this was not like we don't really know like how
yeah,
to have these conversations and it's like through the learning that we say okay this is very beneficial we need
mhm.
to build upon this.
And there's there's a phrase that I have really come to appreciate in those situations where we have a friend or somebody in our lives, a friend or somebody who's saying, God, my life sucks, or I'm really struggling, man. Something that indicates that there's a story. And oftentimes, particularly with males, if I say I'm really struggling, yeah, yeah, that sucks, man. Get a beer.
Yeah.
Versus and the response that really matters is that if somebody is saying, "I'm really struggling with whatever, fill in the blank," say, "Wow, that's important for me to know. Can you tell me more about what's going on?
Yeah, it's
Tell
like
me
being
more, tell me
curious.
more, tell me more." Because oftentimes people will share the tip of the iceberg. "I'm pissed." Is, like, "Yeah, life sucks." If somebody says, "I'm really angry," or "I'm pissed," for the person listening says, "Wow, what's going on? Tell me more."
Yeah.
And now and will often and as a therapist, it's certainly true because my job is to get deeper and deeper and deeper in what's the backstory is.
You know,
That if we can do
you just
that.
mentioned something very important because I don't like as much as I enjoy therapy, I don't like the fact that, like, my therapist will ask certain questions that will get me to really open up about what's really going on. So, it I think it's a really I think for me, it's because I sometimes like, and I think a lot of guys do this. Sometimes we'll say something and then we'll leave it very like ambiguous. Like we're
Mhm,
not really
mhm,
like specific about it. We're just kind of like, well, I just had a fight with my girlfriend. It's like, okay,
yeah.
what does that mean?
That sucks, yeah,
Yeah,
or that's hard, yeah. But if you ask a follow-up question, "So what was going on? What was it like for you?
yeah,
Tell me more what did you come away with from that fight?" Because there's fear, she might leave me, there's anxiety, I
yeah.
might have hurt her some way I didn't know. There's all kinds of backstories to that. Do you not like it when your therapist pursues that line?
So I like it and I don't. And because I'm very, like, inquisitive myself, I like to ask people a lot of questions, and so for someone else to do that and have that space is just very, like I don't know, I honestly, like, I enjoy it, but it's also, like, challenging, I would
Mhm,
say.
mhm,
It's challenging to really, like, look deep within about what's really going on because you can get so used to kind of compartmentalizing things and saying, "Oh, this is no big deal,"
yeah.
and then when someone is, like, showing curiosity about something, it kinda throws you off.
Right. And well, and that we're not used to it. And yet
Yeah.
the very reason for being in therapy is to figure ourselves out.
Yeah, I definitely, like, I recommend it to people. I think men like, for men that are listening, I think I understand, like, the resistance to it, but I think we need to approach therapy with I think it also depends on the therapist. I think there's just a stereotype of you're just gonna talk about your feelings, but that's not I haven't really like, feelings come up, but, like, is more about how can we challenge the self to be, to get to grow and mature. That's how I see therapy,
Mhm,
and I think it's very beneficial. I've been researching, like, the physiological side effects of therapy, and it's
mhm.
actually very interesting.
And what have you learned?
Well, with, like there's a sleep aspect, getting better sleep and also just not being, like, so tense. I feel like when we're carrying a lot of, like, anxiety and stuff, we're very, like, tense wherever you carry it, whether, like, in your shoulders or your, GI system it can be like, we carry things, like, emotions aren't just, like, I feel something, it's you carry it.
It's a classic book, called The Body Keeps the Score, but
Yeah.
our emotions feed the body and our body feeds our emotions. And that's why connecting those dots it's really important because we do get tense. And when we get tense, we get anxious and we're much more likely to be reactive rather than
Mhm.
reflective. And
Yeah.
where we want to live our lives is in a reflective stage. What's going on rather than a reactive, having to be on the defensive all the time.
Yeah, I think it's a challenge. I think because it's a challenge because we feel like if we're being reflective, then we're not being productive. But, who says being reflective? Who says it's not like productive?
Exactly.
Yeah.
I really have come to appreciate putting life in slow motion. It's just
Yeah.
like, get off get off that fast train and just, give everything a lot of thought and, take action, but don't act like there's an emergency on every issue that I have
Yeah.
to have an anxious response, or I've got to be on the defensive, or I have to be on the offensive.
Yeah. I think that's why we can get into like arguments about certain things. And I've realized this a little bit recently in my personal friendships is that um it doesn't like not everything needs like an argument because like, the default and inclination is to get defensive and get argumentative. But really, if we're if we're just trying to really listen about what the other person is saying, then there can be like a lot of productivity.
Yeah, much better.
I think even if we don't want to hear it, you have to.
Yeah. Take it into consideration.
Yeah.
Yes. Yeah. Yeah. So I have to go, but thank
Yeah.
you so much for inviting me on. This has been a useful conversation. And this is the second time I've had a chance to talk with you. And I'm really, really excited about you becoming a therapist. So I'm just
Well, thank you. That
delighted with
gives
the
me
idea.
encouragement.
Yeah, absolutely. I mean, you're just always built for it and made for your thinking now is just going to be a gift to people you're working with.
Thank you. Thank you for
Keep being
being
you.
on. Thank you
Well,
for sharing your insights, your research, and your experience is really valuable. Yeah. Right. Bye.